Perfect. Thank you. Thanks everyone for being here today. I can get us kicked off and then turn it over to our team of experts who will be guiding you through one of my favorite of our learning sessions for Store It Safe on how to have lethal means restriction discussions with families. So we can go ahead and advance to the next slide. And I will just give a quick kind of preview of so today's presenters have no relevant financial relationships to disclose. And next, just want to give a thank you to our funder on the next slide, the Indiana Department of Health, who has helped with all of this, and we're always grateful to work with them. And then on the next slide is the reminder for our participants to please put your name and practice in the chat. So that will help us with attendance. As all of you know, Kristen is out of the office today, so I am her colleague with the Ohio AAP, and the chat will help us with kind of telling her who's here. Next slide, please. So the agenda for today is lethal means restriction discussion basics. And when we get to that, I'm actually going to turn it over to another team member. But then following, we'll have our virtual reality communication training with Doctors Joe Reel and Matthew Zakoff. So I will let them introduce when we get to that, and I'll wrap us up with reminders. But at this time, on the next slide, we'll kick off that lethal means restriction discussion basics. And I will invite Dr. Zhang to take over.
Great, thank you. I'm so happy to see everyone for what's going to be a really great session. This will just be a little snippet rather than the bulk, but just an overview in terms of lethal means. Restriction discussion basics. This is, as we've talked about before, meant to be wrapped into all of our preventive health visits. So well child visits, sports physicals, as another piece of that framework of how to keep children safe. So normalizing that way, as an example here on focusing on how to keep Johnny safe when he was younger and just adapting that discussion to the risks that are going to change as he gets older. The idea is that we're not focusing just on firearms, but all lethal means. So including things like alcohol, prescription, or even over-the-counter drugs, Tylenol as an example, medications in that discussion. Next slide. And I think there might be one more bullet. Next slide. So again, just reinforcing that this is a part of preventative care of injury prevention, and to do this in a broad way. Next slide.
Are you guys seeing the ask a bit differently slide? I think okay. I
We
think
are.
my slides might be really delayed. So do you want to pull them up on your side for the VR part?
And I am seeing that. I know there's a few clicks, but we do have ask a bit differently.
Okay, perfect. So instead of asking that, do you have guns in your home, trying to prevent that from seeming more confrontational, asking, kind of skipping that question of do you have, or what is in your home, but moving straight to if there are lethal means in the home, and explaining that that includes firearms, prescriptions, medications, drugs, alcohol. Are they kept secure? And then specifying, what does secure mean? Are they locked and away from you, so inaccessible? Next slide. And perfect. And then providing education on the why, explaining as our parents and families are likely aware that young preteens, teens are still very impulsive, still developing that ability to emotionally regulate, which can very quickly override their still ability to control those impulses. And so the focus on in the event that something unexpected happens that maybe to us or their parents seems really minor or insignificant can really feel huge and lead to a quick or a rash decision that, if they have access to lethal means, can be irreversible, can be deadly, those consequences. And so, even without a history of depression, understanding and just explaining that impulsive actions can quickly lead to deadly results. And so, having a barrier is going to keep them safe. Next slide. And so the summary, the highlight is that that any child that with or without mental health concerns should not have unsupervised access to lethal means. That this is the goal to implement universal screening and education, and doing this in a way that families will be receptive to. So with that, I will pass the presentation over to Doctors Reel and Zakoff to get the discussion going.
I think there might be one more slide
Oh, there.
that I can jump in real quick on regarding the project specifically and the lethal means reduction workflow reminders. I can also pop these in the chat. But as a reminder, the providers should be having these discussions with the parent and caregiver, regardless of screening results. As was just highlighted, it's applicable to all the teens. The youth may or may not be present, kind of based on your office flow. Printed resources are recommended regardless of screening results, if possible, to give the youth rack card, crisis rack card, and firearm owner resource. Offering lock boxes, we do have a limited supply, so we encourage you to sort of be thoughtful in how you go about that, considering which families you offer to, and maybe after the first month or so, you can evaluate how you're doing that. And then please document and enter your QI data on the iPad. But if you need to adjust your QI data entry workflow, Kristen will be happy to chat with you about that as we move forward. So those are kind of the administrative reminders. And now we are ready to pass it back to the team and enjoy this very cool virtual reality discussion training.
Joe, you have to let me share the slides.
Yeah, I just shared them. And we'll introduce ourselves to start. Matt, can you hear me okay?
Yeah.
It feels like I'm having some internet issues over here, so I apologize for that. But I'm Joe Reel. I'm a general pediatrician at Cincinnati Children's, been here for around 10 years. I co-lead our digital simulation training program with Matt. So Matt, I'll let you introduce yourself.
Hey, I'm Matt Zakoff. I'm a peds intensivist at Cincinnati Children's and co-lead digital training with Jim.
Yeah, and we have another colleague from our team here, Love Preach, who is going to be helping us with some of the virtual reality cases. So when we get to that part.
I clicked it, so if the lag's still happening, it's not just a you problem.
I think it looked better probably than my lag. So
Okay.
I can do the talking for the first part if you want, Matt. So what you'll see today is a program that we developed in collaboration with the MGH Center for Gun Violence Prevention and are currently implementing with medical students through a program for the New England Journal of Medicine. So we're super excited to be here with you guys so that we can get this to our practicing providers as well. So anytime we talk about firearm injury prevention, we do want to take a moment to just recognize and acknowledge that discussions around firearms and violence prevention can certainly be deeply personal, that this is a zero judgment zone, that everyone brings their own experiences to this issue. And our efforts here are not about gun control, but rather to just ensure that pediatric providers have the skills and confidence to talk with families about firearm safety as part of our goal of decreasing firearm-related injuries in our kids. So today we're going to focus on two groups of skills. We're going to focus on what are called our reach skills and then our motivational interviewing skills. So our reach skills here on the left are going to focus on how we introduce this topic, right? Because I think one of the most challenging parts for us in practice is how do you transition to a topic around firearm safety, right? So we'll practice or we'll introduce a few of these skills first, and then we'll practice them in the VR environment. So the first skill that Matt's pulling up here is something called a contextual announcement. So this is sort of a way to transition from your normal safety anticipatory guidance to the topic of firearm safety and also provide a little bit of insight to a caregiver around why this is within our scope of practice. So as we go through each of these skills, we'll provide examples of some language you might use, but certainly this is not the language you have to use, but hopefully it gives you some words to kind of practice with today, but also can practice with after the session today as you try and implement some of these skills in practice. So one way I like to do my contextual announcement is if I'm seeing a patient named Alex for a routine checkup and I just talked about, car safety, that is for me an easy way to transition to firearm safety. So I might say something like, I'm really glad to hear that Alex is using an age-appropriate car seat. That's great. As part of my safety counseling for all my patients, I also like to talk about firearm safety because we know that young children, that toddlers are curious, right? We know that Alex likes to explore her environment. So that can lead to the next skill, which is a little bit of presumptive teaching around what secure storage looks like. The reason I find this helpful in providing this information before asking about firearms in the home is that it gives families some idea around what secure storage actually looks like, right? Because if we just jump and ask, are all the firearms stored securely in the home? A family might think, I have it on a high shelf. The child can't reach it. So yeah, it's secure, but we know that that is not secure storage, right? So after I make my contextual announcement, I might say something like, one of the things we've learned over time is the most secure way to store a firearm is making sure that it's unloaded, that it's locked, and that the ammunition is stored separately. So this leads naturally to a screening question, right? So you can go to the next one, Matt. So you might say, I'm curious for firearms in your home or maybe other homes where Alex may spend time. Do you know how they're stored? Are they stored locked and unloaded? So you'll see a few things that we did. If you go back one slide, Matt, in that last question, is we're sort of presuming that there are firearms in the home, right? So just kind of presuming that they're there and really focusing on storage practices. So we're not asking, do you own a firearm? We're asking, how is your firearm stored? The other thing I want to highlight here is that we also ask about, in other places that Alex may be around, right? Or other homes or places they might spend time. That allows parents to get information around perhaps secure storage without having to disclose personal access in their home, right? And I will say that all the phrases examples we're providing today are ones that we developed in Cincinnati with our community. We did focus groups with a number of individuals coming from neighborhoods where we had high rates of firearm related injuries to help figure out what words felt best for them. In the first part, the contextual announcement, the other thing I like to say is this is something I talk about with all my patients, right? Because we don't want patients to feel singled out for whatever reason, that maybe you're only bringing this up to them, that this is something I talk about universally with everyone. You go to the next slide, Matt. So that was kind of like our contextual announcement, again, introducing the topic, transitioning from something like car safety to firearm safety, maybe doing a little bit of teaching around secure storage, and then screening for the storage practices. So why don't we go ahead and practice that? And what I'm going to do is jump to a computer next door where my colleague is so we won't have this Wi-Fi issue. So hang tight for 1 second.
Yeah.
While Joe's getting his computer set up, this session goes best if it's not me as the participant practicing these conversations, but I'm the fallback. And so we are looking for a friend who wants to put themselves out there and practice this conversation, knowing that it's a safe space, that you're the first volunteer, that the first case is usually the easiest case, and that the goal is for everyone to learn. And then I have the benefit of I have two former trainees on this call. So if no one else volunteers, they know that they're going to get cold called to participate. So anyone particularly interested in volunteering to practice the first case and be in the clinician role? Looks like Dee said she can. So you want to make sure your camera is visible. And then the rest of us will disappear and we can practice documentation.
All right. Can you hear me okay, Matt?
Yep.
Okay, let me just do one phrase real quick here since I click
Okay.
Could you hear that okay, Matt?
Yep.
Okay, excellent. Okay, well, I will tell you a little bit about the case here. So you are seeing a previously healthy 24-month-old female child named Alex. She's accompanied today by her mother, Phyllis, for her annual visit. Through obtaining the social history, you learn the patient lives at home with her two moms. You've already spent time connecting with the patient and are nearing the end of the visit. You move on to a discussion around safety and anticipatory guidance. You just finished reviewing car seats, and now you want to turn your focus to firearms. So whenever you're ready, you can take it from there.
Well, hello, Mrs. Smith. It was really fun to, see your daughter today. And we, talked about some safety issues, including car seats and how to keep your child safe. So I'd like to move on to another safety issue, safe storage of all potential lethal things that could hurt your child. And that would include firearms, alcohol, prescription, and over-the-counter medications. So, our job is certainly not to judge. We just want to make sure your child is safe. So, I just want to make sure that you're keeping these sort of potential lethal things out of your child's way. And if they're locked and kept away.
That's not an issue for us. We don't have any firearms in our home.
Okay, great. And then how about the other things we've talked about? Potentially prescription medications or over-the-counter medications like Tylenol.
Guys, have a fun weekend.
Sure.
Okay,
I'm not
thank you.
sure.
Oh, you're not sure if you have
Hmm?
Tylenol in the home?
Right.
Okay. Thank you. Well, when you go home and it's a safe time, please take the time to go through your cabinets, maybe your bathroom or your kitchen or wherever you would keep those things, and please just make sure they're out of reach for your child. Do you have any questions about this?
That sounds good. I will check with friends to see if they have any firearms in their homes.
Okay, great. Thank you.
Yay, great job.
All right. Thank you.
All right, so Matt, do you want to lead a little debrief for us?
Yep. And then you said I messaged you about some people in the lobby.
Oh, okay.
And so, yeah, so what did people think? Who wants to give Dee Dee feedback as to how the conversation went? Um, things that she did really well, things that you liked that she tried, skills that you noticed. I can start. It looks like Kristen says she's good at not being judgmental. She also transitioned nicely. Totally agree. She anchored into why she's talking about this with families. That contextual announcement was fantastic. Other thoughts from folks listening in?
Yeah, I think broadly addressing not just firearms, but medications. I think just making it very general and as part of her routine discussion.
Yeah, definitely. Looks like Jeremy put in, let's see, Sarah has, she probably addressed safe storage, which was great. Jeremy also comments on group firearms with other lethal means, super important. And then see if this is something she does with all of the families. And so prevents any stigma or question, why are they asking me that question? Other thoughts, other things people noticed? Have they looked at a field of cameras off? Awesome. All right. Well, I think that was a good example of that contextual announcement, some presumptive teaching, and then giving that permission to kind of go into more details and provide more information. And so I can pull back up the PowerPoint slides and we'll cover a little bit more content and offer up another case.
Yeah, I think one thing I've seen when I'm talking about different types of access to lethal means, Matt will often like start with medications and kind of use that same approach and then lean into firearms. So I think you can use these same contextual announcements, right, to go from one to the other. So, one thing I like to talk about is, medicines, because we know that, young kids can get anywhere and everywhere, right? And then after you've talked about that, then you can lean kind of into firearms. For some people, that feels better for them. Other people, they'd rather start with you know, firearms because we certainly know that even though medicines are the most likely way that someone might attempt to die by suicide, they're the least fatal, right? So we know firearms are exceptionally fatal. So if you're limited on time, then perhaps just jumping right into firearms makes a lot of sense. So, but that was great. Do you want to pull our slides back up, Matt?
Yeah.
All right. Well, I can go through a couple more skills and then we'll practice another case. So, Matt, if you want to go to our next slide. So the next thing we're going to focus on is secure storage itself, specifically extrinsic storage devices, because certainly for me, this was a real barrier to my counseling. And I think for a lot of us, we might not be very familiar with different types of storage devices. So we do want to take a moment to review those so that you really feel like you can provide families with, actionable advice when you're talking about secure storage. So Matt, if you go to the next slide. So we certainly, I think most of us know kind of the ideal tenets of secure storage, right? Which is having a firearm unloaded, locked, and with the ammunition separate. But let's talk a little bit more about that locked piece. So Matt, if you keep going. So we're going to talk and focus really on three devices today: cable locks, lock boxes, and firearm safes. So a cable lock here, you can see it looks a little bit like a bike lock. It goes through an empty magazine well of a firearm. It can be opened here like with a combination lock or a key. It tends to be affordable for many of our families and accessible in many clinical settings or even in public settings like libraries or fire departments. They might be available for families. They often come with the purchase of a firearm as well. And so families might already have access to a cable lock. One of the key things to remember about a cable lock is in order to use it, the firearm has to be unloaded, right? Which is advantageous for us from a safety standpoint, but some families might not see that as an advantage, which we will talk more about. These are widely available, all the retailers below, including Amazon. Lockbox, I think what we've learned over time is this is very much a preferred storage strategy for many of our families. It has lots of utility, right? This can be used for storing medications like Tylenol, or it can also be used for storing firearms. It's like a small safe. Not if you click again, there's a little bit more of a range when it comes to the cost of a lockbox. The ones that we have in our clinical setting are about $20. So if you want key combination lock, it's probably $20 to $30. If you want something that can be opened with like fingerprints or biometric sensors, it's going to be more expensive, closer to $100. Again, these are widely available. Firearm safe, I think the big advantage here is that this is a great option for families where there are multiple firearms, including long guns. I think one of the things is certainly these are difficult to just store discreetly, right? So families are often going to know where the safe is located, and that's why it's so important that if there's a code for that safe, that is a code that is changed regularly or isn't the same code as the garage or is unique so that maybe an adolescent or someone else in the household wouldn't know what the code is. These can be a little bit more expensive. So for some families, when I'm counseling, if they have multiple firearms and a firearm safe isn't an option for them, you could even think about like a closet with a residential lock that kind of serves the same purpose, right? Of just storing all those firearms in a single place securely. Another one that we won't focus much on today, but is certainly a storage device, is something called a trigger lock. As part of this work, Matt and I have worked with the community to create this curriculum, but we also work with firearm owners and individuals in the firearm industry. And universally, in the firearm industry, trigger locks are a not preferred method of secure storage. And the reason for that is because the use of a trigger lock, you can see that unlike a cable lock, you could theoretically put a trigger lock on without unloading the firearm, right? But then you can have an accidental firing either when you're putting it on or taking it off. And so even though you're not supposed to store a firearm loaded when you're using a trigger lock, individuals do, and that's where we sometimes see accidents. And so this is better than nothing, right? Certainly better than having it completely unlocked, but is not preferred when you think about other options like cable locks or lock boxes. There's going to be a more secure option for families. So here's just kind of a summary of everything we talked about. So cable lock boxes, firearm safes, those tend to be the ones I talk most about with families. And you can see some of the highlights there on the right side. One of the caveats, I think, is that we don't want to sort of be tone deaf to the preferences of families, right? And so we all of us are familiar with the idea of harm reduction, right? We think about that with kind of safe sleep in a household where perhaps co-sleeping is occurring. How do we do that as safe as possible? It's the same idea I think about with firearms. So I always talk with families about the ideal tenants, right? That it's locked, that it's unloaded, that the ammunition is separate. But for some families, it might be really important that that firearm is loaded, right? For whatever reason, if they have a firearm for personal protection reasons, even though you can remove these locks very quickly, it might be really important that for a family that the firearm is loaded. And if that's the case, certainly a cable lock isn't going to be an option for them. So then you want to think about, how do we move families from the least safe to the most safe sort of way to store a firearm? And so perhaps a lockbox would be a more safe option for the family if the firearm was loaded in terms of thinking about someone getting access to that firearm. So hopefully that makes sense. And we'll practice that a little bit in our next case. So you can kind of see perhaps what that might look like. Now, certainly these conversations, like a lot that we have in medicine, we want to build rapport with families. We want to have some collaborative decision making around what strategy is going to work best. And so that's where motivational interviewing can be really helpful. And so we just wanted to highlight a few skills that we have found particularly helpful when we have, practiced in real life or talked with experts or individuals in the firearm industry. So the first skill is asking permission. That is exactly what it sounds like. It's asking permission to provide information. So I think the place you can fit this in is, after you kind of screen for those storage practices, the family might say, we have a firearm, we tend to keep it loaded, we don't have it locked, or it's, in a bedside table. It might be a good opportunity to say, is it okay if I share with you some ways that we can store the firearm a little bit, perhaps as secure as possible, because I know you're here today because you want to keep Alex safe. It just gives families control in this conversation, and I find this is a really helpful way to sort of navigate it and give families information around storage devices. Autonomy. So this really focuses on emphasizing a family's choice when it comes to thinking about storage. And so the way I do that is after I introduce some of these different strategies, cable locks, lock boxes, I might ask a family, based on what we've talked about so far, what do you think is going to work best for your family? And then a final skill we wanted to review today is just affirmative statements. These are statements that help to convey and emphasize a family's strengths, skills, or abilities, things they're already doing, right? So, when you get to the end of this conversation, I find a nice way to sort of, move to the next topic is just saying something like, I really appreciate you talking about this with me, and I really appreciate how dedicated you are to keeping Alex safe. So we have lots of skills in our toolbox now, right? We got some strategies here on the left on how we can kind of introduce this topic and screen for storage strategies. We've learned a little bit about some of the storage devices that will be available to families, and kind of how we can navigate that conversation most effectively through motivational interviewing. So maybe we can jump into another case. So let me pull that up.
Joe does his computer shuffle dance. Ooh, there it is. Who's our next volunteer to be the next? Looks like Bryce.
And let me pull up this case.
Bryce, I'm not sure if the actual lens of the camera is covered because it shows with black.
Yeah, I don't know if it's not allowing me to access it because of Zoom with our settings.
That's all right.
Well, as long as you can, as long as you can see us.
I can see you. I look great, by the way.
Perfect.
All right. Well, I will tell you a little bit about this case. So you are seeing a previously healthy a 4-year-old male child named Alex, who's accompanied today by his father, Phil, for his annual visit. Through obtaining the social history, you learn the patient lives at home with his mom, dad, and a 2-year-old sibling. You've already reviewed everything with Phil, and you move on to discussing safety, anticipatory guidance. You've just finished car restraints, and now you want to turn your focus to screening for lethal means for access to firearms in the home. So whenever you're ready, you can take it from there.
Well, Phil, it was great to see you and Alex today. I hope mom and sibling are doing well. Since we just finished talking about car safety stuff, I did want to remind you, because it's summer, about making sure between 1 to 4 year olds in the United States, we know drowning is the leading cause of death. So making sure that they're swimming safe and swimming with life jackets. Along those same lines, we often like to talk to everyone about all of the other ways we can keep our kids safe at home. So particularly thinking about lethal means, which means, having medicines, alcohol, prescription and non-prescription medicines, and then firearms and other things like sharp knives out of the way of these toddlers who are very good about getting into things. So I just kind of wanted to touch base with all of that. If you have specific questions, I'd be happy to chat about them.
Yes, but we keep it loaded. I bought it
Okay.
to make sure our house was safe in the event of a break-in. We had one of those a few years back, and I felt helpless. It was scary, and I never want to feel that way again.
Yeah, that sounds very scary. I'm sorry for that situation. In general, I like to just kind of let parents know that it's really important to make sure that those things that could be harmful to the kids in our house are stored safely. So even if they're in the house, thinking about ways that we can make sure that there's no access to those things. So a lot of times I like to ask if you guys have thought about like what types of storage devices or storage options there are available to sort of keep the gun in the home, but maybe not loaded, and maybe have the ammunition separately so that the kids are safe.
We keep it on a high shelf that Alex can't reach. Alex never goes in my bedroom.
Okay, so it sounds like you've thought about trying to keep it safe. Sometimes, despite even parents' best efforts, I know my kids often make it into our bathroom, and we have very little privacy there. So even though that space is supposed to be for me, sometimes they end up there. So a lot of times I tell parents, even if it seems like it's a place that's unreachable, toddlers can be pretty good climbers. And so it's often good to think about, is there a place in the home we could keep it where it would be a little safer? So either in a separate space from where he can access, or even in like a lockbox or a firearm safe, or at least considering whether or not we want to put some little cable lock safe on it so the gun is safe even if it's out.
Do you think we really need one of those?
That's a good question. I think in general, because kids are curious, it's probably the best way to keep everyone safe. And while medicines and stuff are certainly a cause of ingestion that lead to hospital visits, firearms are probably the most lethal means or the most deadly way that kids can find something in the house and harm themselves. So for me, it's kind of one of the big safety things at home.
I think the lockbox could work.
Excellent.
What can you tell
Lockbox.
me about a lockbox?
That's a great question. Yeah, the lock boxes are small, little compact units where you can keep the gun locked, and that usually has a combination or some sort of code that allows the box to be locked. Typically, if you have a lock box, it's good to keep the firearm in that space and then try to keep the ammunition somewhere else. And that way, even if they're accessed, one thing is accessed, the other's not. And I think that's probably the best way to keep both Alex and his siblings safe.
This was very helpful. We will look into getting something to keep the firearms safe this weekend.
That sounds great. And our office has a program where we can kind of talk about that as well. We have some lock boxes that are good for individual handguns. So if that's something you're interested in, we could certainly talk about that.
That sounds good.
Well, thanks for the option to talk about this. I appreciate that you're keeping your family safe.
Awesome.
Yay, so great.
All right. Who has feedback, thoughts, reflections, kudos? See, Kristen says, great job repeating messaging and giving ideas that work for his family situation. Being concrete with your messaging about fire and risk was helpful. Totally agree. Other thoughts, comments from the group?
I think affirming what he was already doing and trying to keep it out of reach, and then being very understanding and I think just sharing experiences with your own family to show that that there's no judgment in what he's doing, but there are ways that we can improve.
Yeah, definitely. Dee says, did a great job being non-judgmental and asking permission, autonomy, affirmative statements, all great. Yeah, totally agree. Let's see. And whoever S'more13 says, I just want him to talk to all my patients too.
I agree. I feel like you're already qualified to teach this course, so you just let us know. Um,
Another one, I like that multiple options were offered and adding about curiosity of kids getting into places we think they can't go to. Yeah, all of that was fantastic. I think a couple of like little things to consider or to think about. You did a great job, like giving this contextual announcement of why you're talking about it, giving a lot of proactive teaching at the beginning. The only thing that can sometimes be helpful is just presuming that those things are present. And so jumping to asking directly, like, how are you currently storing any firearms that may be in your home? And then that like just normalizes that they're out there, that many people have them, and so let's focus on the storage strategy, whether as opposed to whether they're present or not.
yeah, and I'll just highlight again, I really love that you kept going back to like the curious nature of Alex really kind of motivating you to think more about this because I think one thing we've learned through this work is talking about firearms themselves as posing a risk isn't as sort of like impactful with families, but then aligning it with like why you would be talking about this and focusing specifically on the child's curiosity and emphasizing your shared value and keeping Alex as safe as possible. That was just so wonderful. So that was really well done.
Cool. Lisa acted that in the chat. Other thoughts? All right.
Yeah, and hopefully people are sort of seeing that like that conversation went great and really well and didn't take that much time, but is combating and giving families advice if something could be potentially fatal, right? And so we have so many things to talk about, but recognizing that drowning in this age group, firearms are some of the leading causes of death. I think those are the things I think about when I'm prioritizing my time. So So these first couple of cases we've done have really focused and thought about, how do we include counseling on lethal means during our sort of like routine visits, right? Um, but we certainly know, I think, especially in young children, that unintentional firearm injuries account for just a small percentage of all the firearm-related injuries and deaths that we see across this country. So we know that, for instance, suicides, right? Those account for the majority of firearm-related deaths, and we know that access really matters. So simply having, access to a firearm in a home increases the likelihood of suicide 3 times. And so what we want to do next is really think about, okay, how can we take all these skills that we just practiced in our routine care and apply them to a new situation. So our next case we're going to do is a adolescent with depression, some mild depressed mood, no history of suicidality, but how can we kind of lean into these behaviors to provide effective counseling on lethal means? So I'll let Matt kind of recruit here, and I'll kind of switch over to our next case.
Great. We're gonna take the last one. Cheers. Doesn't she seem really nice to talk to? Who wants to talk to this last friend? Otherwise, I'll leave it to Jeremy and Ellen to fight it out as the two people who I know more. Also, Joe, can you just check the waiting room again?
Check the waiting room. Yep, can do. Didn't see anyone in it before, so I think
Yeah, no, we added the iPad for the teenager. We have a different one with kids that have a book. Well, anyone? Any takers? All right. Well, for the sake of time, you'll get to watch an intensivist do this conversation and see how that goes.
All right, Matt. So if you're up, I will tell you a little bit about this case. So you are seeing a previously healthy 16-year-old male adolescent named Alex who lives at home with his mom and dad. Alex is accompanied today by his mother. Her name is Phyllis, coming in for an annual visit, and he completed screening instruments, we'll say the PHQ-9, at check-in, and it looked like he had some moderate depression. So you did a confidential interview with Alex. He reported that he feels mostly in the middle. He doesn't have any current suicidal or homicidal ideation. He also reports no prior suicidal ideation or attempts. You ask Alex about firearms in the home, and he shares that there is one. So Alex gives you permission to talk with his mom about his mood and the firearm in the home. So you discuss Alex's mood with mom, make the plan to start therapy through school, and next you ask Alex to step out so that you can talk with mom a little bit more. And so this is when you're going to chat with her about the firearm. So let me have Alex leave there. There he goes. And you are all set.
All right, Phyllis. Well, I'm glad that we have a plan in place for school-based therapy and what our follow-up plan will be. The last thing I kind of want to talk about is Alex let us know that he knows that there's a firearm in the home. And so I wanted to talk a little bit about secure storage, some of the best practices about securing it unloaded, locked, and separate from the ammunition, and was curious to learn how it's currently stored in your home and what options there are there.
Yes, but we keep it unlocked. I grew up with firearms in the home. It's what I know. I am familiar with them and appreciate having the freedom to own one if I choose.
Yeah, so totally agree and can understand that. I think since today's focus has all been on how to keep Alex safe and how to avoid a terrible accident from happening, would it be all right if we talked a little bit about some of the different strategies that are available that might work for you and your family to keep the gun more secure?
Sure.
Awesome. So there's a couple different devices. There's a device called a cable lock. That's by far the cheapest, $10, $15 at the most. It goes through the firing chamber and then it's locked. And so in that way you can't load it, can't fire it, and a quick combination of key can open it up. I can get that from any retail store, big box store, etc. The next kind of option is called a lock box. And so it sounds exactly what it is. You place the gun in a box that locks, and so you can lock it with a key combination. And then depending on how many firearms you have at the home and how large they are, there are the safe version of that become more expensive. And so do any of those sound like they would be feasible or would work for you to, again, kind of keep Alex safe of a bad accident?
Do you think we really need one of those?
I do. I do. Like we've been talking about, you've been making decisions your whole life, Alex's whole life, on how to keep him safe. This whole plan today is how to keep Alex safe. And so if there's very simple things we can put in place to avoid Alex making a decision that leads to an action that we can't recover from, to me, it feels worth it.
You're right. I want to keep Alex as safe as possible.
Awesome. Do any of those devices that we talked about seem like they'd be a good fit for you all?
I think the cable lock could work.
Awesome. Awesome. We have some in clinic, and so I can go grab some. But then otherwise, I'm really happy that we were able to kind of make a comprehensive plan from therapy, follow up, and then avoiding access to some of those more lethal means in the home to keep doing what you've always done, which is focusing on keeping Alex safe.
You know, Alex stays with my sister a lot, so I am going to talk to her about this too.
That's great. That's great. And feel free to reach out to us so we can be hopeful about how to have those conversations or finding access to other resources. Are looking for devices. All the ones we talked about are available on Amazon, Dick's Sporting Goods, Home Depot, etc.
That sounds good.
All right, how'd I do?
Pretty good. Pretty good, Matt. So I guess I can lead the debrief for you. So what did people notice? What were some of the things that people felt then Matt did well during that case?
Great focus on safety. Keep circling back and coming back to that. And then I also appreciate, I think, just how direct you were when she asked the question, is this really necessary? It's like, yes. It's like, no, oh, probably, or maybe. It's like, absolutely, this is important. And then moving on from there. So I think that was really, really great.
Yeah, I agree. There was a phrase you used, Matt, that I've heard you use before, and I really liked it when you said, you don't want an accident to happen that Alex can't recover from. Like I feel like that language is really powerful when I've kind of said that in clinic and it makes sense. And it's the whole reason why, Phyllis is there at the pediatrician's appointment. So yeah, I really like that. I see a couple of comments, non-judgmental, asking permission, using affirmative language, which was great. What else? What other things do people notice? They feel went well, or maybe something they might try a little differently.
I think in both the scenarios, or at least in the scenario, they family mentioned, looking at other households, but I think reminding ourselves to
Uh-huh.
just include that we know you're going to have play dates or they're going to be in their friends' homes, and trying to remember to screen for that if it's not always prompted.
Yeah, absolutely. I think we know kids often spend times in so many environments, and we know that firearms can also be stored in cars. And so I try to keep it fairly open-ended. And we certainly also know that in homes where there are not children, where they might be spending time, a firearm might be more likely to be not secured, right? So then just reminding them, yeah, to think about all the places that Alex might be going, I think that's really great. The other thing I like that you did, Matt, one of the things I think we learned when we developed this is that families have a strong preference for using the term firearm when discussing this, and so do firearm owners, as opposed to guns. Now, in this case, Matt, the mom said, I think like I grew up with guns, and so I think once the family uses that language, it's perfectly fine to mirror that language. But that was a learning for me. Some families felt that the use of the term firearm, especially with counseling young children, felt appropriate because that term's like a little bit less accessible to younger kids as well. And so they felt more confident discussing that with their provider, with their small child in the room. So just something I've learned if it's helpful for others. Also, having the parent leave, right? If you have a teenager and you're talking about storage strategies, I don't know if I was as good at that earlier on, but I definitely do that now where I have, swap out the parent and the patient so that, as you're kind of brainstorming with the parent how to keep things as secure as possible, that the patient isn't aware of those strategies as well, right? Especially if they're unaware that there's a firearm in the home, right? Because maybe even if the patient doesn't say there is one, I always try to then swap out with the parents and just say, with all my teenagers, I also like to talk about safety things and then do that contextual announcement and provide the advice just like Matt did in this case. Awesome. Any other thoughts people had on that one? Or Matt, anything else you want to add around that case?
No, I think just sometimes it just takes practice, right? Like getting stringing the words together, having the statements, feeling comfortable with um, how you're going to phrase things, because otherwise we all hesitate to dive into topics that we're not comfortable talking, and so would strongly encourage with family, friends, colleagues, just practicing what your spiel is to introduce the topic using the skills that we talked about today, and then it's much more likely to just roll off the tongue the next time with the patient.
Yeah, and I think when I first started doing this, I was sort of worried that some of my patients might, I don't know, that it might like disturb the trust we have or the rapport because they're, thinking that I'm presuming that there are firearms and they don't have a safe household for their child. But I have found it's completely opposite. Like I think the families that we're seeing, they read the news or, they're on the internet, they know that firearm injuries are happening in their community. And so it is amazing actually how many families have said like, thank you so much for bringing this up. I always wonder, why my pediatrician was not talking about this. So I think Matt and I's hope, and I think the Ohio AAP's hope is that, we can really shift that sort of narrative and make this just a normal part of the care that we're providing. Just like we talk about, when we go to our visits, they talk about, alcohol and smoking cessation. Like we can do that same thing for firearms in pediatrics. I think we just have to start doing it more. So but that's it. So we're always trying to make this session better. So thank you for tolerating some of our early tech challenges as we got started. But there's a QR code here that you can scan to give us feedback about maybe how this would be helpful. And if anyone's interested in individual training, please feel free to reach out because we all can offer that for providers as well.
Thank you so much. I always love this session. I'm glad Kristen was out today, so I got to be here to listen into everything. We'll just wrap up with some final reminders. So if you don't have your printed resources in lockboxes, you can email Kristen to let her know that we have already done some tracking. So we will make sure you have everything you need. Please complete your workflow and submit by July 15th if possible. Be sure all participating providers in your practice have completed that pre-program confidence survey. I think that was one of the last things that was touched on. If you're not confident in these topics, it's harder to have the conversation. So we're going to look at beginning and end of program confidence to help make sure we're moving you forward there. Please do start planning for entering your baseline data. Kristen will follow up with an email with specifics. And as you start putting your SIS implementation, working on interventions and entering data, do reach out if you have any questions, encounter any obstacles. Hopefully you're well prepared to get started, but I know our team is definitely on board with helping any way that we can. So with that, I just want to thank Dr. Zakoff and Dr. Reel and your team for joining today and leading us through this again. We are grateful for all of our participants as well. If you have any questions, let Kristen know or feel free to respond to any emails and reach out to us. But thank you so much for your time today. Thanks, everyone.